Families often ask what family therapy is and what we mean by that. And I think what's often behind the question is an assumption that when we invite the family to come for treatment, what we are trying to do is to treat the family, that we think there's bound to be something wrong with the family if their child has a problem such as anorexia nervosa. That's not a very helpful way of thinking about family therapy, because actually what we mean by family therapy is that we need the family as a resource because they can help. That may sound like a bit of a cliche, but I'll explain that by saying how we work with families specifically when we try and work with a problem such as anorexia nervosa. Perhaps more broadly, there's a reason why we use family therapy as the key way of working, because there's good evidence that that achieves the best outcomes. So we know that the research has shown consistently over many years, including our research and research that's been done in the United States and in Australia, that the best results, particularly for young people suffering from anorexia nervosa, but there's now also evidence that's true also for bulimia nervosa, the best results are achieved when the family is actively involved in the treatment to help the young person. And I'll come back to how that might happen. But there's another reason why families need to be involved. When you live with a problem such as anorexia nervosa, everybody gets affected. It's not just the young person, it has an impact on the whole family. And the way that happens, while it might vary from family to family, there is something that's common for all the families. The longer the problem goes on, the more they feel stuck, the more helpless they feel, and the more they perhaps believe that there's something wrong with them as a family, and it's very difficult for them to change that. What happens, I think, is that some of the things that families do to try and help, they may be very sensible and they may have worked with other problems. When they find that they're not working, they begin to change. So, for instance, when the parents are trying to encourage the young person to eat, the young person feels pretty scared and feels nobody understands what it's like. And the more the parents try, the more they feel they're getting it wrong. And so they either put more pressure on in a way that the young person doesn't find helpful, or they back off, and the young person may feel maybe they don't care anymore. So things that used to feel helpful suddenly feel unhelpful. For the family as a whole, that sense of helplessness can end up making them feel completely paralyzed and they don't know what to do. So in order to be able to get them to feel that they can help, we need to help them rediscover what they're good at. So a key part of what we do in working with the families is try and understand what these particular parents, what this particular family has found helpful for them in, being parents, in looking after their kids, dealing with problems, etc. There's another reason why I think family therapy is so important when we're working with something like anorexia nervosa. For the young person, to begin to change is extremely difficult. And it's difficult because, from their point of view, nobody can understand what's happening for them psychologically and how scary it is for them to change. And the difficulty is that we know that in order for people to recover from an eating disorder, one of the first things that needs to change is not how they feel, how they think, but they need to be physically better. They need to begin to be less affected by the effects of starvation. They need to be at a place where they can begin to think in a way that's less affected by the problem itself. And that's an incredibly hard thing for a young person to do. And they need somebody who can encourage them. They need to feel that the person who's encouraging them understands a bit more what it's like. And so the early work with the families is very much about helping the parents begin to feel that what they're doing is that they're looking after their daughter or their son, and that the caring and the love and the affection that is in there is not experienced as parents trying to be controlling or intrusive. And our experience is that usually very early on that begins to change, and as the young person begins to feel that maybe they can trust mum and dad to help them, they begin to eat maybe a little bit at first, and then the effects of that begin to be obvious fairly quickly. Their mood improves, maybe only slightly at first, but it makes the parents feel more confident, and the more confident they feel, the easier it is for the young person to accept their help. It's a virtuous circle that we can then build on to the point where we know that most of the young people get better.